Gillian Keegan.
Thank you very much. It's a pleasure to serve under your chair, and I'd like to thank the Honourable Member for Hartlepool for bringing this debate. It is important to get the facts out into the open and ensure that any erroneous arguments about the use of third-party companies in the NHS are put into context and understood by people, and indeed that the 1.3 million people that work in our NHS are assured that they will continue to do so and are not about to work for a private company. We will have all turned to the NHS for help at one time or another, and I think it's safe to say that all of us are proud of our doctors, nurses and community carers. However, our healthcare system, which is regularly rated the best in the world, will have to adapt and change as we all demand more and more from its services. And part of this change may include the use of third-party companies, and indeed does today. Whether this has been to build our hospitals, sometimes in transporting patients, or as we see in key services such as dentistry or GP practices, all of which are private. The challenges faced by the NHS are significant, and in my view, to tackle them, we need to adopt a collaborative approach between all sectors to ensure patient outcomes remain the driving force behind the health service. Indeed, a patient-first system. A big part of improving our health system, recognised by my right honourable friend, the Health Secretary, is better integration of health, social care and community care services. And if we can achieve more integration, we will both improve services and save money, and indeed reduce some of the fragmentation that was referred to previously, which is not a factor of who runs the service, it's a factor of how the systems are designed. When I served as a governor, I will give way.
I thank the Honourable Lady for giving way, but does she not recognise that if parts of the service are in competition with each other for their financial survival, it is very difficult to integrate them and it does cause fragmentation?
I do recognise that, and I do recognise that as a challenge, not only actually just in competition, but also in terms of organisational kind of ownership as well. Sometimes organisers want to control things that they can control themselves, and certainly we've seen that in West Sussex when we tried to put together two public sector pieces under an accountable care organisation, and at that moment we're going to have to find a different model to do that, and it's not to do with finances, not to do with competition, although that can occur. It's actually to do with the will of the leadership to want to work in a more collaborative environment. So I do accept that there are many challenges that we do face as we go towards the future that we must go towards. A big part. If we can achieve this integration, though, the prize is worthwhile because we will both improve services and we'll deliver them more effectively. And when I served as a governor in my local hospital, St Richard's, I saw firsthand patients occupying acute beds in our hospitals when, in medical terms, they were perfectly fit for discharge, but they needed care. There were not sufficient community care services for patients to be discharged to. And this would be exacerbated if private community bed options were also removed through petitions such as this. It's been the ambition of all major political parties to implement a modern and fit-for-purpose health model that fully integrates both community and acute care. But I think we can all agree that despite best intentions, this will be easier said than done for some of the reasons we've just discussed. And it is also like trying to change the wheels, the tyres on a car whilst you're still driving. This is difficult because this is a system that's operating today. In my constituency, Chichester, we've capitalised on the support offered by this government, such as the Public Health Grant and the Better Care Fund. And West Sussex County Council is working on preventative action. And as part of this, Chichester is home to one of the 7 wellbeing hubs across West Sussex. It's run by the District Council. The Wellbeing Hub works one-to-one with people, supporting them to reduce their risk of diseases like heart disease, cancer, type 2 diabetes through sustained lifestyle changes, helping people to lose weight, be more active and develop techniques to reduce their risks of falling, to name but a few. These services are provided in conjunction with local, community and voluntary organisations and third-party companies who provide a wealth of different expertise. Over a quarter of my constituents are over the age of 65, and therefore adequate social care integration is vital. West Sussex County Council, in partnership with the Coastal West Sussex CCG, has connected local authorities, GPs, voluntary, community sector partners, third-party companies, primary care services and our Community Foundation Trust to form 2 local community networks. And even that list of names, I think, spells out some of the complexity, even today, with delivery through through the public sector as well. But these networks divide the population to the areas of the south, and more, which is a city, and more rural areas of the north, understanding that the needs will be different in each locality. As part of this, they've formed the Social Prescribing Project, where a team of community referrers will be co-located in GP practices across the district to find community-based solutions to non-clinical issues. I recently visited a local charity. The charitable sector is very heavily involved in the delivery of many of our healthcare services. And the Sussex Snowdrop Trust works with children who have life-threatening illnesses and is part funded by the NHS, part funded by charity and donations. Their nurses give specialised care at home and teach parents how to care for their children. This is very seriously ill children. The impact of their work is clear. And we should not underestimate the importance of working with community partners who specialise, like the Snowdrop Trust. And the corporate structure of these partners is less relevant than the importance of the work that they do. The government has set out not only to better integrate the entire healthcare system, but also to allow local commissioners to dictate the health provisions to suit their populations. In cases like the Snowdrop Trust, to provide a specialist, local services for a very small specific portion of the population, the outsourcing funding model is effective and it provides an invaluable service to families. I fully support the work being done by the local authorities in Chichester, who've already put plans in place tailoring services for the different needs of different parts of the population, both rural and urban, focusing on prevention and adult social care in line with the government's 5-year forward plan. These changes are long overdue and will take time to bear fruit, but I believe will be key to achieving a truly integrated health service. Being overly prescriptive about who can be involved in delivering services will limit the options in a world where we move towards integrating health and social care, the wider use of technology, and a bigger emphasis on preventative treatment, many of which will be new. What is important is the right level of patient care is delivered quickly and efficiently to all of those, and it's free to all citizens who need to rely on our wonderful health service. Yeah.